I'm Bodo Knudsen. I'm the director of the Ohio State Comprehensive Kidney Stone Program, and I work in the Department of Urology. My practice is 90% kidney stones. We focus on both the surgical management of kidney stones as well as the medical management and prevention of stone disease. We do about 500 surgeries a year related to kidney stones, and this breaks down into a number of different procedures. So our research program ties in very closely with our clinical program. We're involved in a number of clinical trials looking at new devices to help break up stones and clear stones. We're also involved in some drug trials looking at new medications that might help kidney stones pass so patients could avoid surgery altogether. And we also do a lot of work with lasers and new devices in a more of a lab setting for that. I've been in practice at OSU for almost 7 years now. And we do about 500 surgeries a year related to kidney stones. The bulk of these are flexible ureteroscopy, where we go up to the kidney with a little camera and break up the stones with a laser. We also do percutaneous surgery, where we make a small incision over the kidney and go in with a camera directly, and this works extremely well for large stones. So we do about 125 of those a year. We also do a small amount of shockwave lithotripsy. We've seen in the past a lot of patients treated with shockwave lithotripsy, and while shockwave lithotripsy is still a good treatment for certain stones, there are other options now that are available. We see a lot of patients who've had shockwave lithotripsy elsewhere and have failed and have now come to OSU for treatment to try and get rid of their stones. The area that's really grown and expanded is flexible ureteroscopy. That's a procedure where we go up to the kidney with a tiny little camera on a giant video screen and find these small stones in the kidney that we can break up with a laser. Not only can we break them up, but we can actually take a little tiny basket and remove the fragments from the kidney afterwards to truly get the patient stone free. And for us, that's really been a major breakthrough in the way we treat patients. Our goal is really to try and personalize the health care that we deliver to the patients, and that means looking at them as an individual, finding out what their problems are, looking at their imaging studies, and coming up with a treatment plan appropriate for them for their stones. After we treat the stones, that's when we focus on the preventative side. So we do 2 24-hour urine studies after patients have recurrent stones, and that allows us to identify individual risk factors that we can try and reduce so that hopefully they have less stones in the future. The great thing with stone practice is that we can really make a difference for the patient. Somebody can come in pain and with lots of problems and poor outcomes in the past somewhere else, and we're able to come up with a treatment plan to get rid of the pain and improve their life afterwards. For me, this is extremely rewarding because you really can make a difference in a patient's life. We've built a program that's based on all the latest state-of-the-art equipment. Our operating rooms are second to none in terms of the equipment that we have there and how to treat the patients. But also we have support from other departments. We work very closely with nutrition. We have a dietitian who comes to our clinic several times a month. We also have now been working on building an outpatient surgery center, which will make surgery even more convenient for patients, allow them to get in and out quickly. Our clinical engineering department at OSU, who's really key with all the technical equipment that we use, has been extremely supportive. So overall, it's been a fantastic partnership between myself and the medical center. My wife also works at OSU. She's a family practice physician at the Upper Arlington Clinic. We're very involved with OSU. We both have learning communities of medical students, so usually 2 or 3 times a month we have medical students over our house for dinner, so that's a big part of our lives. We like to travel, so in our downtime we do like to get away and see different places. I go to a lot of meetings related to kidney stones around the world, and we often travel together to these things.